My name is Poulina Uddin. I'm a general and invasive cardiologist. I see patients both at Scripps Mercy Hospital as well as Private Cardiovascular Institute in La Jolla. I became a cardiologist for a number of reasons, but ultimately it was because it was the field where I felt that I could actually really make a difference in somebody's life. It's one of the fields that I felt provides both an opportunity for secondary care, so somebody comes in with a heart attack or an arrhythmia and you can actually help to solve the problem, but also for primary prevention. If you can catch these people before something terrible happens to them or even catch their family members, and really if you can connect with the patients in the right way, you can really improve their quality of life down the road. So I trained in both general cardiology as well as integrative and holistic medicine. I was fortunate to be able to do a combined fellowship at Scripps Clinic, and so although I treat all disease processes related to general and invasive cardiology, I also have an additional background in some functional and integrative and holistic medicine, which just offers an extra toolkit for some chronic illnesses, and a lot of patients are very much interested in, I would say, adjunctive or alternative therapies, and luckily I've had a lot of exposure to that as well, and so when it's appropriate, I'm able to bring that into the patient's care as well. I think all physicians and healthcare providers have realized that you really have to figure out where this patient is coming from, what is it that makes them tick. Before you try to go ahead and solve their problem or treat their symptom, you really need to understand this whole individual, and having that background really helps me to be able to do that so that I can tailor their therapies or their treatments in a way that it's best served to that particular individual. With regard to what types of patients I care for, essentially anyone who walks in the door and wants to see a cardiologist, but specifically, of course, I deal with valvular issues, coronary disease, arrhythmias, if people need pacemakers, those types of procedures as well as care I can provide. I also spend quite a bit of time dealing with lifestyle change and prevention, people who just want to be healthier, want to take care of their blood pressure, want to lose weight, want to have increased functional status overall. So I'll take care of people who are both sick and need help, as well as those who are healthy and want to stay healthy. I've actually had the benefit of beginning my training here, being trained by the experts in the world, and now I get to call these individuals my colleagues. And from having such a long-standing relationships within the Scripps system, I've been able to see the high quality of care that's provided here. And without reservation, I brought my own father to get stented into the Scripps system because I knew that this would be the best care that he could get. The most rewarding part is when I see these patients over time and it looks like they're doing well, they feel well, and they're really enjoying a great quality of life.